901-825-0652. That's 901-825-0652. Again, all these details are available at wvwfoundation.com. Thank you for your support as we try to help people around the world understand the times through the lens of a Christian worldview.
Colonel Rob Maness has a lifelong record of providing dedicated service to this nation. Having worked his way up from the enlisted ranks to full colonel, he served our country for more than 32 years. He has served as a bomber squadron commander, bomb disposal technician, Joint Chiefs of Staff Operations Officer, assisted the National Security Team with the campaign plan for the global war on terrorism. He authored the first theater nuclear war plan, and served as the Vice Commander of America's largest airborne intelligence wing. Colonel Rob Maness is a true American hero. This is Rob Maness Live.
The Justice Department reportedly investigating Medicare fraud in the U.S. The probe comes as DOJ is also digging into the issue. Fox Business' Grady Trimble live in Washington with more. Hey, Grady.
Hey, Dana. The DOJ is specifically looking into United Healthcare and its billing practices related to Medicare Advantage. That's according to the Wall Street Journal, which says the Justice Department has launched a civil fraud investigation into the company. But UHC is firing back, calling the report misinformation and adding any suggestion that our practices are fraudulent is outrageous and false. Separately, as you noted, Elon Musk says DOJ is going to tackle Social Security and medical waste and fraud, suggesting Americans could receive more money and better health care as a result of DOJ's work. But Democrats claim President Trump wants to cut Medicaid.
What he is doing is cutting with a chainsaw important services that benefit every American to make room for those tax cuts for the very rich. And so they want to cut things like Medicaid, Medicare.
Well, Trump, though, has said publicly and told House Republicans behind closed doors that cuts to Medicare should not be on the table, or Medicaid, I should say. Speaker Mike Johnson says the budget is aimed at waste, fraud, and abuse within that program.
We're going to look to find that. I do think we're not looking to make cuts to Medicaid, but certainly work requirements are something that I don't view as cuts. Work requirements are just common sense.
And by the way, these Medicaid and Medicare fraud cases that Republicans are talking about, they're not just hypotheticals. Just last week in Massachusetts, a businessman was charged in a $30 million Medicare fraud scheme using that money to buy luxury cars and watches. Republicans say there's a lot more of this fraud going on in addition to these cases that are already getting prosecuted. Dana?
Grady Trimble, thank you.
Doging. That's the new verb in Washington, D.C. and around the country. And Elon Musk is doging Medicaid and Medicare. Welcome back to Truth Thursday here on the Rob Maness Show, folks. And we're live on Worldview Tube, our X Spaces simulcast, Rumble, YouTube, Truth Social Plus, Amazon, and Roku. Well, $2.7 trillion. That's a really big number. And Elon Musk's Doge team publicized it as the total of improper payments they think they're discovering in their auditing effort of Medicaid and Medicare in early February. By each agency's own recent public admissions, and they post this stuff, they make more than $30 billion of improper payments every year. This has got to stop. Look, while we Americans have a lot of disagreements on health care these days, on this issue, I think we mostly agree that these funds have to be spent on our citizens that need the services and pay for them. And fraud, waste, and abuse has got to be eliminated in these agencies. We live in a country that has a $37 trillion debt, and we now pay more than $1 trillion a year in interest on that debt. That's more than we are spending on defense, folks. Well, my guest today is author Sally Pipes. She is president, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. She's joining me to discuss her opinion piece from just a little over a week ago in Newsmax titled Time to Administer DOGE to Medicare and Medicaid, where she points out, and I'll quote this, the two government programs have been cesspools of malfeasance, incompetence, and duplicity for too long. And the cost of all this corruption and waste has grown at a staggering clip in recent years, close quote. Sally, welcome to the Rob Maness Show, and thank you so much for spending some time with my audience and I.
Well, thank you so much for having me. It's great to be on and discuss this important issue. I'm really excited that President Trump announced the DOGE because Department of Government Efficiency under Elon Musk, who's never worked in government, so he understands how a profit and loss system should work. And so this is very exciting. And I know a lot of Democrats and progressives are very upset. But as you pointed out in my initial quote, there is a tremendous amount of fraud, abuse, malfeasance in the Medicare program, the program for our seniors, and the Medicaid program, the program for low-income individuals.
Absolutely. And, you know, I've taken a look at your bio, obviously, and you're an author of several books in this area of expertise. What was interesting to me, though, is that it seems that you come from a market-based perspective instead of a government healthcare perspective in your writing about this. And I'd say you're an expert in this area based on what I've read so far. And am I right to assume that you were opposed to Obamacare like I was and would still like to see the government out of our healthcare system as much as possible?
Well, absolutely. And I grew up in Canada. I worked at the Fraser Institute, where in the late 80s, we started a program called Waiting Your Turn, a guide to waiting lists. And in 1993, the average Canadian waited 9.3 weeks from seeing a primary care doctor to treatment by a specialist. Last year, that number, over 30 weeks from seeing a primary care doc to treating by a specialist. And all healthcare in Canada is single payer Medicare. There's no private coverage. So I've been fighting against these intrusions into our healthcare system. And President Obama, when he signed into law Obamacare, March 23rd, 2010, his real goal was that we would end up being in a Medicare for all single payer system, as Bernie Sanders gets on the stump as often as possible to say we need government health care. He never talks about the waits, the doctor shortage, and lack of access to the latest treatments and drugs in Canada.
Oh, yeah, that's why I'm opposed to it. Look, I'm in the VA healthcare system now, but I grew up in the military government healthcare system. And under the VA system now, if you are very lucky if you can get a primary care appointment at a VA facility within 6 months of the day you make the phone call. So it's something's got to be done. I'm very pleased with what President Trump did in his first term, and I hope to see some new advances in the next term. So in your article, Sally, I'll just repeat those words: a cesspool of malfeasance, incompetence, and duplicity. Why did you write those words down? I mean, those are very strong descriptors. I happen to agree with them because I know government and I know what's going on, especially now that we've seen the USAID scandal and those kind of things. But those are very powerful words. And you had to have something very specific in mind for these two agencies, Medicaid and Medicare, when you wrote it.
Well, exactly, because I think people just think that government has money and they're going to pay for all of this. Government does not have money. We have money and we pay taxes to support these programs. And government programs are often programs that are full of abuse and fraud. And so it was the government's Center for Medicare and Medicaid Services has pointed out that that Medicaid performs slightly better in terms of improper payments than Medicare, but still 5% of the payments were improper in the Medicaid program, and that figure is $31.1 billion. The government is spending about close to $1 trillion on Medicaid. Now it's a program run jointly by the states and the feds, but the feds pay most of the money out, $31.1 billion for a 5% improper payment. And this is and about 18 million people in the country out of the 80 million covered on Medicaid are enrolled in Medicaid. We're not eligible for the program. So, we need to get these numbers down so that the program Medicaid and the program for the elderly Medicare is there for those people who truly need it and people who are disabled, low income. So it's very, very important that we get this under control, and that I think Elon Musk is the man who can do that.
Yeah, how does, let's take one of them, Medicaid. How does that system work? You mentioned 18 million ineligibles are on the rolls or more. How does that happen, and who's controlling that?
Well, I mean, the Medicaid, the number on Medicaid, as I say today, is about 80 million. A few years ago, before COVID, that number was a lot less. It was probably around 60 million. But during COVID, remember, the government said under President Biden that anyone could enroll in Medicaid, and there was no sign or a program that would show whether you were eligible or not. So, as you can imagine, it was just a lot of people then signed up, and we're at 18 million, and they should not. These people are ineligible, but they weren't able to get rid of them, and so we need to work on that right now, and that is what Mr. Musk is going to do. Because if people are quite smart when they figure there's no actual test to show whether you're eligible or not. So during COVID, it just growed like topsy, and it was supposed to end this extended program in 2023, and the government has not ended it yet.
Why am I not surprised? I think one president said that the closest thing to eternal life is to be a government program. I think, if I remember correctly, Ronald Reagan that said that. So Medicaid, though, I thought was controlled by the states. I'm not eligible for either one of these programs, so I have to ask some of these questions that may seem oversimplistic for you. So how does that interplay work? Real quick before we go to the break, and we can continue the discussion after the hard break come up.
So, Medicaid, as I say, is a program for low-income Americans. And if you're below 139% of the federal poverty level, then you are eligible for the program, which, as I say, is managed by the states and the federal government. Up until COVID, between 50 and 75% of Medicaid payments were made to the states by the federal government. During COVID, though, they increased it. So 90% of the funding comes from the feds and goes to the states. So the states had ended up paying very little for this Medicaid expansion. And so they obviously want to keep it large because they're getting all this money for their state budget. And as I've written about just recently, I mean, we need to have work requirements for people who are able-bodied and should not be on Medicaid. And some of the states have introduced this. I saw today Iowa is going to introduce work requirements for those people who are on Medicaid who are able-bodied. So we'll see. There's been a tremendous pushback on that as well. But we need people who are on Medicaid and are eligible to work should be out there working.
Absolutely. There's a big debate in my state about whether to do the Medicaid expansion that Obamacare offered. We can talk about that after this break. I'm very curious as to what your thoughts on that and how that debate should go. One of the things they're dangling out there is work requirements. We'll be right back with Sally Pipes, who's really an expert on Medicare, Medicaid systems, and the fraud, waste, and abuse that Elon Musk is finding right now.
Hello, I'm Brandon House. I want to thank you for all your support at wvwfoundation.com that helps make possible pushing out 24/7 content for free. Without your support, we'd have to put it all behind a paywall. But thanks to you and your support through our foundation, we're able to push it out for free as a broadcast service and broadcast ministry of WVW Foundation. Please consider going there and setting up an automatic monthly contribution, or go there and make an occasional contribution. If you prefer to support us through the mail, you'll find our mailing address there at wvwfoundation.com. You can also call and make your contribution over the phone by calling 901-825-0652. That's 901-825-0652. Again, all these details are available at wvwfoundation.com. Thank you for your support as we try to help people around the world understand the times through the lens of a Christian worldview.
Mr. Speaker, you said that this is just the start of the process. Can you say unequivocally that further down the line there won't be any cuts to Medicaid programs?
Yeah, so look, let me clarify what we're talking about with Medicaid. Medicaid is hugely problematic because it has a lot of fraud, waste, and abuse. Everybody knows that. We all know it intuitively. No one in here would disagree. We had a hearing in budget just last week, or week before last, and they asked the experts, and the estimate is, I think it's $50 billion a year in fraud alone in Medicaid. Those are precious taxpayer dollars. Everybody is committed to preserving Medicare benefits for those who desperately need it and deserve it and qualify for it. What we're talking about is rooting out the fraud, waste, and abuse. Every taxpayer, it doesn't matter what party you're in, you should be for that because it saves your money and it preserves the programs so that it is available for the people who desperately need it. That's what we're about, and that's what you're going to see happen. We want to make sure that illegal aliens who do not qualify are not on the rolls, and we know that they are in many places. We can achieve a lot of savings with that. We can eliminate all these fraudulent payments and achieve a lot of savings. What you're doing with that is you're shoring up the program, and you're making sure that the people who rely upon that have it, and that it's a better program. That's what we're talking about. You've heard the president say that. You've heard members of the House Republican Conference say that, and no one else has said anything else, except the Democrats who have ads out that are lying about the intention here. That's the fact. The leader just held up the resolution. Do a word search for yourself. It doesn't even mention Medicaid in the bill. So that's the important part.
To clarify, some of the savings will have to come from Medicaid.
I just explained those categories of savings. I just explained that. So watch how the process plays out over the coming weeks, and you'll see what we're talking about.
Welcome back to the Rob Maness Show. We're talking about Elon Musk. It's doging Medicaid and Medicare, trying to root out all that fraud, waste, and abuse. You just heard from Speaker Johnson there from a clip not that long ago, and he mentioned a word of $50 billion. $50 billion of fraud, waste, and abuse in Medicaid. My guest today is Sally Pipes, who is the president and CEO of the Pacific Research Institute, author of a lot of books in this area, an expert in this, and market-based solutions is what I think, and that's the right way to go in almost every case of this. And nobody wants to get rid of Medicaid and Medicare. We just want to make sure that the dollars are being used for the exact purpose to take care of the American people. Isn't that right, Sally?
Well, absolutely. And, we're talking about my number is from the Centers for Medicare and Medicaid Services from the federal government says about $31.1 billion in fraud and abuse in Medicaid. That is a lot of money. And we've got to, and so when progressives and Democrats say this is frightening, what's going to happen? No, this is what should be happening. And, the problem, one of the problems is, and these people on the left don't point it out, that many of the people on Medicaid, they cannot get a doctor to treat them because the reimbursement rates for the doctors are so low. They're like 30% below what they get for treating a private insured patient. So either they can't get an appointment or these doctors won't take these patients. So if we can cut out the fraud and abuse, it'll be more likely that these patients will be able to find a doctor in a timely fashion rather than not being able to or having to wait for many months. Like as you mentioned earlier, like the vets who are covered by single payer in the VA.
Yeah, exactly. We were talking about Medicaid expansion before the break. I wanted to ask you, because this debate is happening in Mississippi, and I'm on the Republican Executive Committee in my county as a member, and one of our top legislative priorities is to prevent Mississippi from taking Medicaid expansion. A lot of states have done that, and it came in through the Obamacare system, I believe. But that just opens the door to more fraud, waste, and abuse, doesn't it? Because it expands the population to include people that can actually work.
Well, exactly. So, as I mentioned earlier, President Obama signed the Affordable Care Act into law on March 23rd, 2010. It's amazing that it's been that long. But one of the parts of the Affordable Care Act that was one of the mandates within it was that the states would be able to expand their Medicare, their Medicaid programs. Well, that was essential that they expanded them. Well, this went to the U.S. Supreme Court, and the court said that that Obamacare could not mandate that states expand their programs. But as we've seen over the last few years, many of the states, because the feds were offering 90% reimbursement rate to the states, many of the states have gone ahead and expanded their programs. States like California, New Jersey, New York were very quick to expand, but I'm so glad that a state like Mississippi hasn't expanded yet, because even after when President Trump was elected in the first term, even some Republican states expanded the program against a lot of testimony by people in the assemblies and senates in the states saying this is a bad idea. But, you know, it sounds great when government can provide something for free. And so the pressure was on. But I'm glad Mississippi hasn't expanded yet. And I'm really glad that some of the states like Iowa and Georgia are including work requirements for people on Medicaid who are able-bodied and able to work.
Yeah, this 90% reimbursement rate, doesn't that expire at some point in the future after a state takes that Medicaid expansion?
Yes, it was on a downward a spiral. Yes, down a bit, but it's still very, very expensive. I mean, even cutting it down. So let's get the fraud and abuse out. We can see what's going on and allow the patients that are on Medicaid that are disabled and very low income to get Medicaid coverage and to find access to doctors, which is very difficult right now.
Yeah, and I think people confuse Medicaid and Medicare. You could even see that in that clip with Speaker Johnson. There was a little bit of word swapping around there between the two programs. Medicaid is for the poor, right? Disabled people that aren't able to work, and their income's very low, correct?
Well, exactly. So several years ago, I was talking to a very wealthy man who was on the board of New York Presbyterian Hospital and Sloan Kettering. And at the end of our discussion, he said, "What is the difference between Medicare and Medicaid?" And I thought, here you are on two of the most highly rated hospitals in the country, and he didn't understand it. So Medicare is the program for seniors who are 65 or over, and Medicaid for low income. Both of these programs came into being in 1965 under President Lyndon Johnson and his Great Society. So, as I say, they're very expensive programs. They both will be around, if we don't make some changes, both of these programs are going to cost about $1 trillion a year. Medicare covers right now about 65 million seniors, and Medicaid now, as I said, is up to 80 million people. So they're two programs. They sound similar, but they're two different groups.
Yeah, and it seems like the scare tactics I hear a lot are to scare the elderly, you know, because a lot of people still are living that experienced life before the Medicare program and everything. And it's just this fear factor issue. It's so unnecessary because nobody wants to eliminate the two programs at this point. We just want to put the money that's being used to where it needs to be. Like you mentioned, the doctors not wanting to take Medicaid. Well, if we have that $50 billion that Johnson talked about a year available to pay doctors, then as you said, they'll accept the care, and it'll open up more providers for people on that program, right?
Well, absolutely. Today, 1 in 3 new Medicare eligibles cannot even find a doctor because, as I say, just like in Medicaid, the Medicare reimbursements are very low. And so it's very frustrating. You work your whole life, you pay your Medicare and your Social Security taxes, and then you turn 65, you're retired, and you say, well, now I've paid all that, I'm on Medicare. But most people now have to get a supplemental plan or a Medicare Advantage plan if they want to be able to find a doctor and get the coverage. So it's very sad that you work your life you pay a lot of taxes, and then you find you can't find a doctor because doctors are reimbursed so low by the federal government for Medicare.
Wow. It's really interesting. Well, we've got a live audience, Sally, and I do take a question a couple of times a show at least. So we've got a hand up over there. Let's go ahead and take a question from the audience member. Shell is our host. Go ahead, Shell.
We have Joseph, sir.
Yeah, my question is regarding the fraud and abuse that you're talking about. Can you give us a couple of examples of what type of fraud and abuse DOGE could actually remove from Medicaid and Medicare? Like, what actually could it do with that?
Great question.
Well, they can, first of all, they will identify the dollar amount, which we have talked about what it is. These are mainly payments, overpayments to people who are on Medicaid or Medicare. There are underpayments. Some people are underpayments, or payments where insufficient information was provided to the government to whether this payment was proper or whether this person was eligible. So, and you probably have read recently that a number of people who are on getting Medicare and Medicaid payments are actually people who are already deceased. And so this is the kind of thing with Elon Musk's highly trained tech labor force, they are going to be able to find out what are the overpayments, what are the underpayments, who is ineligible for these payments, and who are the people that are actually deceased but continue to get funding.
So when the agencies identify on their own like they do, and they brag, I don't remember if you mentioned this, but they actually brag about being less than 10% in their monitoring of what they call improper payments. That includes some of what you just talked about. But what else is there in that definition or outside of it that we're not exactly hearing about? Is there anything else?
Well, I think those are the main things. I mean, you know, the Centers for Medicare and Medicaid Services, the threshold is no payments should be improper payments should not be more than 10%. Well, so they say, well, we're actually doing really well because the Medicare improper payments are only 7.66%, about $1.7 billion under the fee-for-service Medicare program. So, you know, and then, but in the last 8 years, these payments have been under the 10% threshold. So the government says we're actually doing very well, but that is completely wrong. You don't say, well, you can have it 10% of the payments can be improper, and therefore you're doing well because they're below 10%. I mean, that's sort of like government spending is down because the increase is lower than what the government had said at the CBO. So, you know, $1.7 billion in the fee-for-service part of Medicare alone is a lot of money, and we need to get it not 10%, 8%. We should need to get it down to, you know, 1% or even less. Get it down to zero.
Well, yeah, those two numbers that Medicare and Medicaid brag about, the 30 billion, or they publicize the little bit over 30 billion. I mean, those are both less than 10%. That's a lot of money.
Right. Well, the Medicaid program says that they're actually better than Medicare because their improper payments are only at the 5% level. So, you know, this is a way government statisticians talk about savings in various programs.
Yeah. Well, we got to take another break, Sally. When we come back, we'll hear from Secretary Lutnick pushing back on the media lies about these so-called cuts that don't exist. And I want to dig into the Veterans Health Agency aspect of this Medicare fraud, because I got really surprised when I read Sally's article. We'll be right back with Sally Pipes on the Rob Maness Show here at Worldview Tube. It's Truth Thursday, and we're dodging Medicaid and Medicare.
Hello, I'm Brandon House. Is the government tracking you? Do they have access to all your data? Well, if you go to worldviewtalk.com, you'll find out about a cell phone company that, well, does not store your data. They don't do that. This is what they're known for. They don't store your data. You have privacy. You're not being tracked. That's why a lot of folks are turning to worldviewtalk.com. You'll find their prices are very competitive All the details are there at worldviewtalk.com. Again, worldviewtalk.com. Oh, while you're there, not only do they have cell phones that aren't tracking you, you can find out about how to get a satellite phone. Should the whole system go down and you want to communicate with a family member or a loved one, you might want to have a satellite phone. Or how about their solar generators? They have great solar generators. Check them all out right now. Worldviewtalk.com, worldviewtalk.com.
First off, let's go through. I just want to make clear, we do not need to cut a single dollar from someone in Social Security or someone from Medicaid or someone in the government who actually deserves the money. Not a single dollar. And any Democrat who says the alternative is a nonsense. What we're going to attack is the waste, fraud, and abuse. So think of it now. So the idea, and it's kind of funny, it came from Madison Square Garden, because the deal was between me and Elon that Elon was going to cut $1 trillion from our expenses, and that I was going to drive revenue growth of $1 trillion from tariffs, from oil, and from getting rid of all the tax scams, which we can talk about. I mean, there's so many tax scams against the United States of America, it'd make your head spin. And that would earn us $1 trillion, not cutting a single person's benefits, not cutting a single person's deserve it. We're the richest country on earth. We can give people Social Security. But what we can have is, think about this. There are 6 million people who say they're over 100 years old receiving Social Security benefits.
Welcome back to the Rob Maness Show. It's Truth Thursday. We're talking about Musk and his doging of Medicaid and Medicare with my guest, Sally Pipes, who is an author. Wrote a great op-ed piece in Newsmax about this not long ago, and we're discussing that. And Sally, during the last segment and the one before that, we touched a little bit on the veterans piece, but I'm in the veterans healthcare system, 100% of it. And you mentioned something in your article that caught me by surprise. I wasn't aware of this. And I'll be honest, I'm coming up on Medicare eligibility age, and I've been trying to figure out, since I'm totally in the veterans healthcare system, what actions I need to take, if any. But the fraud that's being perpetrated leads me to believe I'm being told to do something that I don't really need to do or shouldn't do the way I'm being told to do it. What is going on here between the Veterans Health Agency and Medicare?
Right. So the VA, the Veterans Health Administration, is a single-payer healthcare system, and it has the worst wait times, the worst results of any healthcare system. And there has been talk by President Trump about privatizing parts of it, which I hope will happen. But a 2024 study by Health Affairs, a noted journal, found that some Medicare Advantage programs were enrolling veterans who had access to the VHA, the Veterans Health Administration, health benefits. So a large number of these vets got off all of their care through the VA, and their Medicare Advantage plans didn't have to pay for anything. So the Medicare Advantage plans were collecting a capitated payment from the federal government for covering the veteran, and this corporate welfare was costing about $1.3 billion in 2020. So, it's just another aspect of how government cannot determine, who is eligible, who is not, who is dead, who is not. So, this is a big scandal, but by vets getting the Medicare Advantage coverage, and then the insurers getting the money, $1.3 billion in corporate welfare, benefit to the insurers, and that's a waste of money.
Yeah, so if that money wasn't spent on the insurers, that's budgeted, right? Couldn't that be repurposed to go into the VA healthcare system to shorten wait times, for instance?
Right. I mean, during the pandemic, telehealth became a possibility, and it's a really terrific program, telehealth, for members who are covered by the Veterans Health Administration, because in many times, if you're at home or you can't drive, or and you have a problem, you can't get to a doctor, or maybe a long way away to get veterans coverage under the TRICARE system. So telehealth is a great way to reduce costs and to allow our vets to get timely coverage and access to good doctors and good systems. So we really need to make the telehealth program permanent, and it is up for renewal. And I hope it's going to become permanent, because for the elderly on Medicare and for many disabled on Medicaid and for our vets, telehealth is a way to get more timely care and better care by telehealth using being able to access systems like Cleveland Clinic, Sloan Kettering, the Mayo Clinic, really where the top docs are. Which, if you live in a rural community, and if you can't get to your doctor but you can't get an appointment, these are ways to get access to the very best doctors and specialists in our country.
Yeah, I've used the telehealth system in the VA. I've also used what President Trump, it existed in a small way, but he really beefed it up. It's called community care that still exists. And I use an urgent care that's just a few blocks from my house. And it's very convenient. Don't have to pay anything. And if I have to get an appointment for urgent care, I can walk right in almost within 20 minutes. I'm seeing. And don't have to go to the system. So I'm like you, I hope he expands more community care. I'd like to see the telehealth system made permanent. But if I'm coming up on Medicare eligible and I'm a veteran that's in this category, should I sign up for Medicare at all?
Well, I guess it depends. I guess it depends on how quick and how accessible you want your health care to be. So. As I say, the VA is a single payer system, long waits, ration care. So if I were you, I would sign up for Medicare and take out a supplemental plan or a Medicare Advantage plan, which proves to be, much better at getting access to doctors who, if you just had a straight Medicare fee-for-service plan, you may not be able to get a doctor in a timely way or get access to the very best specialists.
Yeah. Exactly. Well, thanks for answering my question. It's very confusing. Well, we got another question over in the audience. Let's go ahead and take that. Shell, go ahead.
We had Roger, sir.
Thank you. She answered my question there towards the end, because I am on Medicare and I have a Advantage plan, Advantage plan, and I get the VA, and I find that I get a lot quicker service through my Medicare. So that's what I was wondering. I didn't understand quite what she was saying at first.
Okay. Well, they're live feedback, Sally. Thank you very much.
Yeah. Yes. So
appreciate it.
So Medicare Advantage, the Medicare Advantage plans, which a lot of Americans who are Medicare eligible are now taking the Medicare Advantage, paying for it. Of course, it's not free, and Medicare isn't free either. Even though we pay, a tremendous amount in taxes. But the Medicare Advantage is a good program, and it has better access to doctors and specialists. So you'd be better off signing up for Medicare, getting a Medicare Advantage plan, than joining the VA, which needs privatization and making it the VA system accessible to vets that really need care. So if I were doing it, I would get a Medicare Advantage plan.
That's great info. One of the other questions I have after reading your article is, the Doge people put out this number, $2.7 trillion in improper payments. Is that a realistic number from your perspective? You've been studying this issue for quite some time. And I just wondered, are they near the target of what it's possible to have to be happening, or should we have a different expectation on this?
Well, I think it probably is about right. We've never we've seen the numbers from CMNS, as we talked about. You can have 10% improper payments under Medicare and under Medicaid, and the people on the Medicare number is about 7.66%. Medicaid, it's about 5%. But we really, these numbers, it's hard to know, what's a million, what's a trillion, but we just need to get it under control. And I think that is the important thing that Doge is going to do in order to get some real numbers on what these fraud numbers are, and they are huge. I mean, as we talked about, 31 billion under Medicaid, and we talked about 1.7 billion for those Medicare people on fee for service. That doesn't include the people that are on the having Medicare Advantage plans. So it's probably a lot more. I think they're probably close to what that estimate is and what they should be aiming for.
What kind of policy changes at the legislative level can Johnson and those guys do to help with this? I mean, some of the money the president can take action on his own on, like through the impoundment process, contracts, canceling contracts, and those kind of things. But if the Congress doesn't take action, some of that stuff will come back to life if they do a continuing resolution passage and those kind of things. But aren't there some policies that Congress can write in legislation that can help address this fraud, waste, and abuse better than we are?
Well, the first thing is, and we've seen right on day one, President Trump has been signing many executive orders to get things under control, and that is fantastic. The problem is if Gavin Newsom became the Democratic president to be the 48th or 49th president, you'll see these executive orders reversed. So what you want to do is get the Trump administration and DOJ to get support among the people in the administration, and then to go to Congress and say, okay, this is what's really happening, and you need to pass laws so that these things can't be reintroduced in a change in administration.
Yeah. I mean, they've got to really get this stuff embedded in the legislation to make it permanent or harder to repeal. It's much more difficult to repeal a piece of legislation than it is executive orders, as we saw when the Biden administration came in.
Right.
They canceled every executive order.
He cut the short-term limited duration plans, which President Trump, you could take out a short-term plan for a year, renew it for up to 3 years. Biden came in and said it's 3 months, renewable for 1 month, which is impossible. I mean, who wants to every 3 months have to, get a new insurance, re-up your insurance? So, and the Association of Health Plans, so much that had been done and was great under executive order was reversed by former President Biden.
Yeah. Well, we got to take another break. It'll be our last one. When we come back, though, I want to dive into prescription medications and how that is woven into this fraud, waste, and abuse, and what can be done about it. My guest is Sally Pipes, and we're talking dodging Medicaid and Medicare, which is in sore need of being done. We'll be right back on the Rob Maness Show.
Doug and Elon are looking at Medicare, so let's see if I can help them out. So far this week, we found pirfenidone, which they're overpaying for by $660 million a year, and dimethyl fumarate that they're overpaying for by $580 million. Today, let's add imatinib. Medicare's paying $2,400 for each prescription. They did that 250,000 times, meaning they spent $600 million on just that one med in only 1 year. At my pharmacy, without insurance, that same prescription would cost $17. At that price, it would cost Medicare $4 million total for the whole country. Medicare is paying $596 million too much for just that med alone. Between those three meds, we're up to $1.8 billion saved. And the cool part is we didn't cut any benefits. Everybody still gets all their medication. All we have to do is cancel the contracts of the middleman who charges Medicare those ridiculous prices. That's the pharmacy benefits manager. Let's kick them out and make some changes. If you want to see how much the pharmacy benefits manager is overcharging you, go to forestparkpharmacy.com to look at a price checker and find out. See ya.
Welcome back to the Rob Maness Show. It's Truth Thursday, and we're discussing Elon Musk doging Medicaid and Medicare with author and really an expert in this area, Sally Pipes, who wrote a great op-ed piece. I recommend you go check it out. Just search her name on Newsmax, and you'll find it. But Sally, I wanted to bring this discussion in because when I came across that guy's little clip, and yeah, it's a little bit of an ad for him, and that's okay. I don't mind that. But the numbers, even if they're a little bit exaggerated, those are huge numbers. And we're just talking about prescriptions and middlemen. We're not talking about government price controls or anything about that yet, which I do want to ask you about. But that's a huge number, $1.8 billion.
Right. So, when talking about prescription drug prices, it's a very, I have a whole new book out called The World's Medicine Chest, How America saved pharmaceuticals and how to keep us as the innovators in pharmaceuticals is a very important issue because there's so much misinformation out there. I mean, America, 2/3 of all new drugs in the past decade, the research and development was done in this country and not in Europe or Canada, and of the 287 drugs that came to market between 2018 and 2022, they were 84% were available in the U.S. and only 28% in Canada. So the question is on drug pricing. We are the innovators in this country because we haven't had price controls on drugs. The countries in Europe that brought in controls, all the research and development, moved to the U.S. But one of the real reasons for higher drug prices is what he said, PBMs, pharmaceutical benefit managers. They are the middlemen that negotiate drug prices between the insurance company and the pharmaceutical company. So the money that they make from the rebates and discounts that they negotiate to get these drugs on the formulary, those rebates and discounts, the reduction should be going to the consumer the patient who goes to the pharmacy to get their drugs. But instead, the middlemen are keeping the savings for themselves and to a lesser extent for the insurance industry. So there's a lot of bipartisan support in Congress right now for reforming PBMs and giving them a set price, not allowing them to have spread pricing and all of these things where they're making the money and they're making the insurance industry money and not giving the returns that should be given to the patients at the drugstore counter.
So these set prices aren't drug price controls; they're just set pricing for the middleman contractor that's making the connection to the insurance.
Right, exactly. Yeah, and there were three PBMs that really control about 85% of the market: Express Scripts, CVS, Caremark, CVS, and United Health, their Optum program. So they are the three big players, and they control most of the market. And they're getting the money. The PBMs are getting the money, and not the patients, as I just mentioned.
Yeah, it's crazy. Well, we got another question over in the live audience. Let's go ahead and take that, Shell.
We have Joseph again, sir.
Thank you very much, Colonel. I'm curious, dealing with the pricing here, how can we properly drop the prices and actually get it to the point where, like, my wife's on Social Security now on Medicare, and some of her prices are much higher than they were when she was on Medicaid as a disabled person. So, I mean, how does that work? How would we be able to do that?
Well, I mean, if Congress passes PBM reform so that the middlemen, the pharmaceutical benefit managers, get a set fee rather than being able to take these large returns for themselves. That will go a tremendous way towards reducing the cost of drugs. The other thing is that, when a new drug, as I mentioned, I didn't mention, but costs $2.8 billion from when a pharmaceutical company applies for a patent to when that drug actually makes it to the market. Only 1 in 10 new drugs actually makes it to market, and it takes about 12 years. So there's intellectual property protection for 20 years for the drug researchers so that they can make a profit. After that, it goes off patent protection, and we have generic versions. So about 90% of the drugs consumed in this country today are generics, and they're very, very inexpensive because they're not they're very cheap. They're much cheaper than they are in Canada or in the UK. So this is an important part, making generics available to the American public, and in particular to seniors who, for the most part, as a lot of seniors have a lot of prescription drugs that they need to take for high cholesterol, high blood pressure, and things along that line. So making sure that the generics can survive, and that the new drugs have intellectual property protection, so that we can continue to be, the world's medicine chest, where we are the country that makes the best and the newest treatments that allow us to stay out of the hospital, and for many cases, and to get really great care.
Yeah, a lot of people die in the hospital. Matter of fact, more people die in hospitals than anywhere else. I think they're very dangerous places, to be honest.
Yeah. So, and people, I was going to say, for people that have, illnesses like high cholesterol and that, it used to be that you would end up in the hospital. You were ill, you couldn't work. But with, a atorvastatin, the generic, you can lead a normal life and work and be in good shape.
Yeah. So do you think when we see this, and we're starting to hear about it again, price controlling on prescriptions themselves through the Congress, how do we fight back against that messaging and other messaging from the media about the lies that we've heard sprinkled throughout this program about the Republicans are going to cut Medicaid and Medicare, when really all we're trying to do is find the fraud, waste, and abuse. Give some folks some tools they could use to fight back against that, and get the real truth out in their own right.
Well, as I mentioned, we are the world's medicine chest because we don't have price controls yet on our drugs. But when all the countries like Germany, France, Britain, all the countries in Europe and Canada brought in price controls, the R&D moved out because there was no incentive to do research and make a return on your investment. So that's an important part of this whole thing. But as you know, when President Biden in August 2022 signed into law the Inflation Reduction Act, which did not reduce inflation, and one component of it was price controls on drugs under Medicare, starting with Medicare Part D, the Medicare Part D program. So starting in January 1st, 2026, 10 drugs under Medicare Part D are going to be subject to price controls. Then January 1st, 2027, 15 drugs under Medicare Part D will be under price controls. And then it goes on up through 2029 when there will be more than 20 drugs that are under Medicare's Part B and D will be subject to price controls. This is really getting the camel's nose under the tent to make America subject to price controls on drugs. Where will the R&D go if it can't be done in the U.S. because of price controls? So Trump's job is to convince people in his administration and at CMS, HHS, that price controls are a bad idea and this legislation should be repealed, and then go to Congress and make sure that Congress is the members, particularly Republicans, who realize what the problem is and how much a negative impact it'll have on R&D, to get Congress to vote against and to repeal the Inflation Reduction Act, and in particular, these price controls on Medicare drugs.
So over time, what will happen to the cost of these particular drugs for the consumer themselves? Well,
a lot of the drugs that are on the Medicare Part 10 drugs. A lot of these drugs are already on generic version anyway and are cheaper than what they're talking about and having the drug having price controls. So, I mean, it's the real issue is the impact on R&D. I mean, there's so many. I mean, just listen to the news. There are new vaccines that are really showing great promise for colorectal cancer, for ovarian cancer, breast cancer, lung cancer. We want to remember Joe Biden said, I'm going to bring in the cancer moonshot. I'm going to be the president who eliminates cancer. But then he brings in price controls, which is the exact opposite. So we want to keep the market alive and open so that we are the country that develops these great vaccines to eliminate cancer. Then other countries can free ride off our R&D, but at least we will have access to the very best.
Yeah, absolutely. From a manufacturing of pharmaceuticals perspective, one of the things we uncovered not long ago is that the United States doesn't really have adequate manufacturing capability for things like antibiotics. Can you see a pathway for Congress to pass legislation to help improve that? I mean, President Trump had a goal to do that, increase manufacturing here inside the United States in his first term, but nothing really came out of it. What's the situation with that, and what are the issues?
Well, the real point is that, Dave, the head of Eli Lilly, Dave Rich just said that they're prepared to spend $27 billion in building new manufacturing drug plants in the U.S. Pfizer said, well, we're considering doing it. But the problem is there are three problems with this. In America, all the mandates and regulations on building and environmental codes, it makes it virtually many years, 10 years, in order to, from an idea to building a plant to actually getting the plant started. So that is a huge problem. So you need to change those mandates and regulations. So if a company wants to build a manufacturing plant, they can do it fairly efficiently. The second thing is that the unions have kept wages very, very high in this country, and it makes it, it's not profitable to produce some of these drugs. So a lot of the generics are produced in India and in Asia because the cost is lower, and then the cost is lower for the consumer. The last thing is we need an educated workforce in this country, and our test scores in math and English are very, very low, and so we don't have that many engineers. We need an educated workforce so they can work in these manufacturing plants and produce the very best. But right now we've got an educational problem that needs to be solved, and it's very important. And Mr. Trump needs to work on that. And he's talking about, they want to get rid of the Department of Education, and I think it's a great idea. Education is a state issue, but we need an educated workforce in this country, and we don't have it right now.
Yeah, I think we completely agree on that. Well, Sally, thank you so much. You can find Sally Pipes on X, and you can get her book from there, too. We appreciate your time, ma'am, and I'll have you on again soon, I'm sure, because there's a lot to talk about in this
there's
space.
So much to talk about. Yes, thank you very much. Well, have a good day. Thanks.
All right. Well, Monday is More War Monday. Jesse Patria, the author of If It Takes 1,000 Years, and we're talking about the coming war on it from Islamists on the United States from within the United States. I'll see you then on the Rob Maness Show.
You're watching Worldview 2, built on the 35 years of Worldview books, documentaries, research, high-profile interviews, and the radio and television broadcasts of Brannon House.
Hello, I'm Brannon House. Is the government tracking you? Do they have access to all your data? Well, if you